Have you noticed pain around your kneecap? Have you started to notice this when you're running, during your new exercise routine, or even walking downstairs? Around 25% or 1 in 4 people experience this type of pain around the front of their knee, and this is more prevalent in runners. It is shown to affect 7% of adolescents and one of the most common knee conditions for this population group. Today in this video, I'm going to be talking about an extremely common type of knee pain and what the 5 common causes of it actually are. If this is relevant to you, then keep watching, as this can make a world of difference to your knee pain and your exercise routine. If you have knee pain and you don't get it sorted out, this is what might happen. Your symptoms can become worse and you'll notice it more with things in your day-to-day, such as walking, sitting, and going downstairs. It may also start to affect your exercise routine, causing pain when you're running or doing a home workout, which may end up deterring you from doing it altogether. If you decide to take action and do something about it, you'll get an understanding of what's going on, so you can get on top of it faster and increase your chances of a successful recovery, as in eliminate your pain fast and for good. You'll be able to continue or get back into your running or your home exercise program pain-free and without worrying about making anything worse. So what is this common culprit of knee pain? I'm talking about patella-femoral pain. This is a pain around, behind or under the kneecap, and usually without any structural changes to the actual knee. It can affect both males and females of all activity levels, but most commonly young females. Symptoms often present with simple daily activities such as running, squatting and walking up and down stairs. If highly irritable, it can be noticeable even with walking and prolonged sitting. Patella-femoral pain has many causes, and as such, there are a lot of treatment options available. Depending on what someone's cause is, will help guide which treatments will respond best and give them the best chance of recovery. So what might cause knee pain? Well, here are 5 common causes. Number 1, we have triggers. These are from excessive loading or a novel and sudden increase in physical demand that your knee cannot cope with. It could be a change in frequency, intensity, or the amount of your exercise load, such as going from running twice a week to 5 days a week. The tissue around the kneecap gets irritated when it gets too stressed. This excessive stress comes from certain triggers and usually in combination with predisposing factors. These factors include poor biomechanics, or in other words, poor movement patterns, and make up our next 4 causes. They cause the kneecap to move towards the outside of the knee, and basically this means it's not moving in the groove the way it normally does, and combined with an overload trigger, causes the irritation around the kneecap. So what movement patterns am I talking about? Well, these include number 1, the pelvis dropping to the opposite side, placing increased tension on the outside of the leg and pulling the kneecap outward. This is what we mean by that. You can see the pelvis sitting level on the first picture, and on the other, you see it dropping down the other way. And number 2, the hip and the thigh bone rotating inward under the kneecap. And so these movement patterns, both 1 and 2, can be due to weakness and poor function of the hip muscles. Number 3, poor support for the knee and kneecap when it needs to take load, such as bending through it. This can be due to weakness and poor function of the thigh muscles, aka the quadriceps. Number 4, the foot and ankle roll in too much, causing the shin and knee to collapse inward under the kneecap. This could be due to weakness and poor function of the muscles in the arch of the foot, lower leg, or even again in the hip. Other factors may come into it depending on the individual, and these may include trauma, recent surgery of the lower limb, the bony structure of the knee, or systemic disease. This is why it's good to get it checked out by a health professional to help rule out anything sinister or serious injury that may contribute. If you want to keep watching and continue with this video, click on the YouTube link in the description, where we delve straight into the simple steps of how to manage your knee and some of the best exercises to treat it. I'll also be posting videos of these topics on my page here shortly. If you enjoyed watching, click on the like button and feel free to share it or tag someone you know who would benefit from watching. If you have any questions, feel free to drop a comment below. And if you want to know more, follow us on Facebook for more videos and blog posts to keep you healthy and pain-free. Cheers.